Hi, my name is Jolynn Scott. I'm from Thurston County Health Department, and I'm going to share some information on Legionnaire's disease with you today so that you'll know what to look for in case you run into it. Legionnaire's disease was discovered in 1976 when 200 people became ill with a mysterious pneumonia-like disease at an American Legion convention in Philadelphia. Dozens of people died at that time, and the bacteria was soon discovered, and it had spread through the air conditioning system. The bacteria that was discovered was Legionella, and it is the leading cause of reported waterborne disease in the United States. There were nearly 10,000 cases of Legionella or Legionnaire's disease reported in 2018. Legionella grows naturally in the environment, especially in lakes and streams that can be the source of our drinking water. The CDC reports that most outbreaks are in buildings with large water systems, such as hotels, long-term care facilities, and hospitals. Those building owners should adopt newly published building standards that promote Legionella water management programs. Timely identification and reporting of Legionella can allow the health department to act quickly to prevent further infections. Legionella can grow and be transmitted to susceptible hosts via aerosolization from these systems. And those systems include shower heads and sink faucets, cooling towers, hot tubs, pools, decorative fountains and water features, hot water tanks and heaters, large complex plumbing systems. And travel is also a risk. And the travel is a risk because the air conditioning in hotels, resorts, and cruise ships have been found to contain Legionella. There are at least 60 different species of Legionella. Most are considered pathogenic and not transmitted person to person. The people that are most at risk are those who are 50 years of age or older. They smoke or have history of smoking. They have chronic lung disease, immune system disorders or malignancies, underlying illness, recent travel or overnight stays away from home, and recent care at a healthcare facility or exposure to hot tubs. The symptoms include headache and or body aches, fever, chills, cough, shortness of breath, chest pain, cellulitis, gastrointestinal symptoms like nausea, vomiting, and diarrhea. Because those symptoms are so similar to many other things, including COVID, testing should be done, and it consists of urine, blood, or sputum cultures. Patients might even be required to test or have two of those tests, and they should be tested if they fail to respond to antibiotic treatment. They have severe pneumonia. They are immunocompromised with pneumonia. They have a travel history in the last 14 days. They've stayed overnight in a healthcare facility. They have an epidemiological link to a confirmed case of Legionnaire's disease. Here's a bonus disease for you. Pontiac fever is an acute non-fatal flu-like condition that's also caused by Legionella bacteria. And the symptoms are similar. The infection source is similar. You breathe in water or steam droplets that is filled with Legionella bacteria. The difference between Legionnaire's disease and Pontiac disease is that Pontiac fever is self-limiting and will go away by itself, but it may be an indication to find the Legionella source. Treatment for Legionnaire's disease consists of antibiotics. Less than 5% of the people who come in contact with Legionella will become ill. Hospitalization is very common, and about 10% of those cases are fatal. 25% case fatality rate if it is healthcare associated. The disease prevention, there is no safe level of Legionella in building water supply systems. The disease has been associated with very low levels of Legionella found in the water systems. Water supplies should always be treated. To control Legionella, corrective actions include maintaining the highest temperature allowed by the state in your water supply, flushing the pipes to clear the Legionella, using a disinfectant, cleaning the tanks or air conditioning systems. Additional action may be necessary and repeated testing is advised. Thank you for listening to this presentation. You can find more information about Legionnaire's disease and Legionella on the CDC website, or you can contact me.